Universal healthcare has been a buzzy topic for years. It's been the focal point of heated debates and political campaigns. But Dr. Marschall Runge thinks most people don't have a realistic view of what universal healthcare would actually entail.
What they're thinking about is a level of healthcare that's like the best of the best, that's available all the time, and it's free. So that's not going to happen.
Runge is the dean of the University of Michigan Medical School and CEO of Michigan Medicine. He says that while having full and free access to the top medicine and technology is unlikely, a more realistic model is what he calls longitudinal health.
You have some level of healthcare that documents what's going on, is available to you for basic problems. It's not going to take care of everything, but it provides that continuity and that interoperability that we lack today. People will argue all day and all night about whether the government can do that. Last time I talked about it, somebody said, yeah, people go to the DMV, because they want to get rapid service. Well, you don't go to the DMV to get rapid service. But there are government health programs that are excellent. And they're the ones that focus around what's a concept called the medical home.
Meaning there's a group of providers, doctors, nurses, dentists, therapists, all available in the same place. This structure exists today in what are called federally qualified health clinics. They serve everyone, regardless of insurance status. However, they're often overwhelmed with patients and spend a lot of money treating chronic, expensive conditions instead of prioritizing preventive care. Still, Runge believes this model can be very effective when done well. But the initial challenge to getting this idea up and running is the shortage of primary care physicians. As someone who interacts with medical students on a daily basis, Runge has a front seat to this drop-off.
In our medical school, a quarter of the class comes in thinking they want to do primary care. And at graduation, which is going to be in a couple of weeks, it's going to be 10%. And they worry about, will they be able to repay their tuition? They worry about the fact that primary care is not well reimbursed. If you're in some settings, primary care may feel like they're not adequately either supported or respected. And I think we have to change that dynamic. And one of the things I'm trying to do here at Michigan is to make it possible for people who really have a passion for primary care to follow that passion.
Because if nothing is done to reverse this trend, our public health will greatly suffer. Unfortunately, finances aren't the only obstacle standing in the way. In fact, the greatest threat to the shortage may be the high rates of burnout physicians are experiencing. Various factors contribute to this exhaustion, including high patient workloads and after-hours paperwork. Thankfully, though there are a lot of challenges in healthcare at the moment, we are in an era of unprecedented solutions that Runge believes will reshape our current system. He dives into this revolution in his new book, The Great Healthcare Disruption: Big Tech, Bold Policy, and the Future of American Medicine. A prominent example in his book is the role of technology, particularly AI, in making healthcare more efficient. Runge says some AI systems may be pivotal in the fight against physician burnout. A big issue doctors run into is having to work after hours to catch up on all the paperwork they didn't get to during the day. There are currently a few systems that are already reforming these administrative tasks.
There's a technology I really only became aware of in the last couple of years called ambient AI. What ambient AI does is it is present, it listens. We always ask, is it okay if we use AI to record our interaction? Some patients don't want that, but most are just fine with it. What is great though is it's not just a transcription. The AI gathers all the information, it puts it in the context of my or your health problems that it knows from the electronic medical record. And then it generates a really excellent medical note, such that when I finish seeing a patient, I can look at that note in about 2 or 3 minutes and see if there's something I need to correct. If not, I'm done with that process.
This technology is not only helpful to the physician, but it can also be a tool to empower patients. The best way to stay on top of your health status is to get it directly from the source, your medical record. However, these documents are often filled with pages and pages of complex language and data that scare many people off. But now, AI can streamline that whole process.
It's often 50, 60 pages of what seems like repetitive and a lot of nonsense in there. If you make a PDF of that and feed it into your favorite AI engine and say, generate a 2-page summary, in about 2 minutes, it gives you a fantastic 2-page summary of what the major issues are, what needs to be dealt with, what you need to do as a person to try to improve your health. And The reason I'm giving that as an example is that physicians and all care providers have to look through that whole medical record, and that takes forever. And they may miss things because everybody's in a hurry. So when you think about ways that AI can reduce the workload and reduce burnout and stress on care providers, I think that can make a huge difference.
Making medical records more efficient is a game changer, but it's not the only solution needed in this space. An issue that's been a thorn in the medical community's side for years is the inability for records to be shared between providers and practices. Not all electronic health record systems are made equally, which makes sharing information difficult at best.
And some of that is, I'm convinced, is intentional. This has been a principle that's been out there for a long time, but it's not really in the interest of some companies that make electronic medical records to make that easy. And so they don't make it easy. I mean, they could make it easy, but they don't make it easy.
Getting past this hurdle opens up so many more possibilities for innovation in the healthcare space. For example, companies like Amazon are disrupting the industry with forward-thinking ideas that increase access to doctors and medication. They've identified the pain points and are providing solutions, like offering on-demand virtual care. However, without the easy sharing of medical records, Runge worries it'll lead to fragmented care where a patient isn't getting the full picture of their health.
I saw an advertisement for Amazon recently. I think it was Amazon, one of the 24/7 services that said, well, you're getting on an airplane, you're worried that you have a urinary tract infection, get on Amazon Clinic and your medicine will be waiting for you when you get off the plane. And that's pretty cool. Of course, it presumes that that diagnosis can be made over the phone, and in many cases it can. But the other aspect of that is none of those 24/7 clinics have access to your medical record. So what if there's something in your medical record that you forgot to say, or maybe you don't even know about, that would be a contraindication, would be bad for you to get a certain antibiotic or to get a certain therapy? Or what if whatever you receive is something that your primary care physician, if you have one, would want to know about? There's no back and forth there.
Which is why making health records more easily shareable will be such a game changer. It's important to note that creating all of these solutions to improve public health will only work if the public cares about their health. We can have all the technology in the world and still fall behind because we're patching up symptoms instead of focusing on preventive care.
One of the ways that we can better afford healthcare is to become healthier. But as it is now, we don't focus so much on becoming healthier. We focus a lot on, I want to have access to the most advanced care. We expect everything from healthcare, and healthcare cannot deliver everything.
So as we demand more from healthcare, Runge believes we need to also demand more of ourselves and have a lifestyle that supports health and longevity. Join us next week as Runge explains how placing preventive medicine at the center of healthcare will lower costs and create a healthier America. You can find more information about Dr. Marschall Runge and all of our guests on our website, radiohealthjournal.org. Our writer-producer is Kristen Farah. Our production manager is Jason Dickey. I'm Greg Johnson.